All right, here we are. We're going into soft tissue injuries, and we're looking at the 6 major types of soft tissue injuries that we're going to see. Soft tissue injuries are going to consist of injuries mainly to the layers of the skin, which would be the epidermis, the dermis, and the hypodermis, along with the body fat layer, and then even lower, the muscles, which meaning skeletal muscles. Now, below that will be bones. We'll talk about those later on, but for now, we're going to consider most of these soft tissue injuries primarily as being minor, but some may be severe to being considered life-threatening depending on the situation. Let's define what a wound would be. A wound would be any physical injury involving soft tissue injuries. This could be a closed wound or it could be an open wound. So how we had talked about internal versus external bleeding before, a closed wound is something where the skin surface is not broken. Tissue damage and any bleeding could occur below the surface. Versus an open wound, the surface is now broken and blood may be coming through the broken skin site, I guess you could say. For any closed wound, we had already talked about this with contusions, with bruises. We're going to see it from a blunt force trauma where layers of the soft tissues or blood vessels beneath the skin have been broken or damaged. It could look discolored, could look swollen. More significant ones, very violent force traumas, they could become life-threatening. So we're looking at more along the signs when we're seeing a blunt force trauma to the chest as well as the abdominal regions overall. Other blunt force traumas could be a broken bone, and we'll get to those later on with musculoskeletal injuries. Severe signals of a severe closed wound, I touched on these all before, last chapter, so I'm going to skip that for you. What I do need you to know is that for minor wounds, we simply go ahead and apply an ice pack with a barrier involved. The time frame we're looking at is about 20 minutes. The reason we put an ice pack on is to help with pain reduction, but also it's going to be cold, right? So the heat that was in that wound, it's going to flush the heat out of that wound. So that way when you take the ice pack off after 20 minutes, warmth is going to go back to that site. You're going to be pulling out old blood and putting in new blood, helping with the healing process and pain management. And healing is what our key goal here is. What we can do is we can tolerate, with pain to only 10 minutes, that's fine. But we want to go for 20 minutes if possible, because that's going to help reduce the greatest amount of inflammation and making sure that a good blood supply is coming back to that contusion or bruised area of the body. Now, we can go ahead and elevate the area, but we do not want to elevate the area if it causes pain or if it is a suspected dislocation or fracture of a bone. Anytime that we see that these could be considered dangerous to the point of life-threatening, we just go ahead and call 911 immediately. So if somebody is just howling in pain, it doesn't feel good no matter what they do when they move it. That abdominal region is swollen or tender, they're coughing up or bleeding externally from their mouth, right? Any of those scenarios, reasons to call 911 right away. Life-threatening is something we know we cannot manage with our basic first aid skills. The 6 major types of open wounds, we'll start with number 1 as abrasions. These are really, generally speaking, very simple to deal with. It's where the skin has been rubbed or scraped away, and it only involves the outer layers of the skin, like the epidermis, the dermis, and maybe even a little bit deeper to that hypodermal layer. They're usually painful because there are a lot of nerve endings at these points, but the more superficial ones, like you're walking through the woods and you get a little scrape on the surface of your skin, you see you're bleeding, those sometimes, right, you don't even notice that at all, and by the time you looked at it, the blood dripped off, but it already dried, and great, not a big deal, just make sure you keep it clean. The main thing is we want to irrigate these wounds and keep them clean at all costs, because any kind of superficial wound, no matter how small, still is having a pathway for infections or bacteria to get within your body. So we go ahead and use soap and water with these wounds, generally speaking. We can use a cloth or light gauze to clean this with water and soap. And then we can go ahead and apply some kind of antibacterial cream if we choose to, like a triple antibiotic ointment, if the person's not allergic, of course, onto the bandage, and then put a bandage over that and make sure we're keeping it clean and covered. Pretty simple things, abrasions. I think we've all had an abrasion at one time or another, and we know the basic care. You wash it, you make sure it's irrigated and clean, you dry the wound, you put some kind of topical cream to make sure you're preventing against infections, and you cover it, and you look at it from 4 to 6 hours later every time repeatedly and changing your coverings. Lacerations are now the second type of injury that we're going to look at, and these are more severe, you could say. This is where there could be a jagged cut or a smooth edge, either way, commonly from sharp objects or sharp edges. can be a result from a blunt force trauma, so you can see these as in a car accident or anything like that. This is also going to affect sometimes deeper layers like the adipose and the muscular areas then of the body with a laceration. I don't know if you kids watch movies. Go ahead and watch the scene where they're trying to rob the semi on Fast and Furious, and you will see a laceration injury. He's got a cord wrapped around his arm, so that's an example of a laceration injury, something with a sharper edge that can dig down deep into a wound. Now, these can sometimes bleed heavily. They can sometimes bleed freely. They're not always painful, but they can become very easily infected because they are reaching even deeper into the body. A good reason, right, to control bleeding right off the bat, because you don't want too much blood to come out, and you want to prevent infection first and foremost. From there, we're going to determine, is this a very deep wound? Is it deeper than just the skin? Is it to the fat? Can we see fat? Can we see muscle? We want to take this person to the hospital. Not that it needs a 911 call necessarily, unless they're in shock, right, or a large amount of blood loss. But if it's minimal blood loss, we're looking at a situation where the doctor may have to sew this person back up. They may need to be put on some kind of antibiotic to prevent infection. So better to be safe than sorry. We'll talk about infections, the signs of those a little bit later. The third one is avulsions. Avulsions is what you could say is a portion of the skin and or sometimes other soft tissues is partially or completely torn away from the body. Like a knife wound or a box cutter, right? If it's cut at an angle, the tissue, you could say, for instance, flips open, right? And it looks like you'd almost lay it right back into the position that you found it, but you have a lot of bleeding, a lot of pain because it's cut through a lot of nerves right there. You almost feel like a heartbeat coming out of that region, that thumping sensation. Bleeding is usually significant since we've really cut through blood vessels at this point. So we want to make sure we're putting direct pressure on a wound like this immediately as possible without causing more pain, okay? Go to your book. It shows an excellent picture. It is a little gory, right? But where is it here? Page 101, figure 7-6. That's a great example of what an avulsion would look like. We would want to put pressure around the wound on that middle finger, but on the index finger, we want to put direct pressure on that wound, definitely. And we would have called 911 hopefully by now as well, too, to help this person. Amputations, these are even worse now. Amputations are where a body part is completely severed. This could be a finger, it could be an arm, a leg, it could be many different aspects of the body. But the damage is so severe that bleeding may not be as bad as expected because it's just a complete severing. We still want to put direct pressure on this wound, and reattachment is sometimes possible, but again, we have to call 911. We have to get the right persons knowing about this injury so that way we can handle it in a more timely manner. So pretty general protocol, right? Somebody were to maybe get their finger chopped off. We put direct pressure on their wound with a gloved hand and with gauze, right? And we take that finger that's been severed, we put it in some kind of clean environment like a plastic bag, maybe a plastic bag with some ice in it, right? And we keep it with that person at all costs because we wouldn't want that person going to the hospital without their finger to be reattached, right? So keep it with the person, note the time maybe, or the exact time I guess you could hopefully find within a 5-minute period of when that injury occurred. Put that on the bag with the person's name on it, that way it stays with them, right? Little things like that. Sometimes more severe, but also sometimes less severe, puncture wounds. This could be something from like you get a splinter to a tack in your foot to a gunshot or a knife wound, okay? We're looking at these as injuries that pierce the skin with a pointed object. And they're usually it usually closes around the object at the same time. So we might not see necessarily bleeding at the start if that object is in place. But if we remove that object, generally speaking, yes, bleeding is going to be seen then. So with smaller objects, yes, it's absolutely okay to remove those things, like maybe a small tack or a splinter, absolutely. But if we're going to go ahead and try to remove like a bullet wound, right? We don't want to touch a bullet. We don't want to try to remove a knife or a screwdriver stuck into somebody, because the second we pull that object out, bleeding is going to start occurring very rapidly. We'd rather leave that object where we found it and put pressure around it. There's a great picture in your booklet, actually, of how to apply pressure to a wound like this when there is some kind of puncture going on. I don't see it right now, but if we look at it later on, we're going to find it pretty soon. Other things then, too. Sometimes we can see puncture wounds as entrance and exit wounds. In this case, we want to look for those things. Maybe like a bullet, for instance. It could pass through the body. Some bullets are designed to go, or some are designed to hit and topple. So we can sometimes see a severely large exit wound compared to the entrance wound. So we want to put pressure on both of those in that case. Sometimes that bone topples and it creates chaos inside of a body. Then we'll see a lot more external and internal bleeding possibly going on then too. Treat these as all severe, call 911. Crush injuries are the next ones on the list. This is where a body part, usually an extremity, is subject to a high degree of pressure. And it may be an open or it may be a closed wound, right? You could get a bone crushed in your hand and not have any bleeding going on. Or you could have a crushed arm and you could see bleeding going on, so on and so forth. The main thing is that the injury is considered severe or there's severe damage going on because underlying tissues are compromised. We call 911 immediately. Say, for instance, there's a person with compartmental syndrome, okay? This is where there could be a severe crush injury to a torso or internal organs where if we remove that pressure from the person, we're going to have all of a sudden, and instead of bleeding, the movie Signs is a great example of this. If you watch the scene of that, Signs where he's talking to his wife after she got a severe injury, this is a great example of what it looks like for compartmental syndrome. A body part is crushed where if you remove that object crushing the person's body, a large amount of bleeding will occur because now blood can go to that extremity. Very dangerous, extremely life-threatening. We call 911 first and foremost. We see what the authorities think to do in that situation. But anyway, we treat any crush injury as severe. We call 911 first and foremost. We're only trained so far to deal with these things. General care, though, okay, we're going to look at these things. What we consider severe, what we consider normal or more minor wounds. For any type of open wound, we're going to control the bleeding first and foremost. We want to prevent infection. So we use our protective barriers. We use clean gauze, clean dressings to absorb fluids, to absorb blood, and prevent the infection in the first place. Furthermore, okay, bandages are going to be used to cover or wrap body parts. They're going to hold dressings in place. They're going to apply pressure to control bleeding for us, then too with like an elastic bandage. They're going to prevent the wound from getting an infection by keeping dirt away and other things like bacteria and so on and so forth. And it's also going to provide some support to that injured area or body part. So these are very pivotal things to have in your first aid kit to support you in going through any kind of these injury processes. Again, pressure bandages are awesome, or elastic bandages. They're going to apply that pressure for you so you can deal with multiple wounds at the same time. Your booklet has awesome pictures, and I showed you a video already where we did wound care on how to put those bandages on. But please go ahead and take some time, watch some more videos. If you type in American Red Cross, open wound or injury care, there are awesome videos out there to get you more hands-on experience or visual experience in this case. And then try to practice these wraps on your own arm or on other people's then too. Our rule of thumb for stitches, let's go ahead and touch on that real quick. Generally speaking, stitches, right, we want somebody to go see a doctor if the edges of the skin do not fall back together, if the laceration involves the face, or in this case, it's the rule of thumb. If the injury is wider than your thumb, it's probably good to go see a doctor because they're going to want to sew that up and make sure no infection can take place and also so you heal and look a little prettier. After any minor or major wound that we're dealing with, right, we've used our PPEs. We want to remove our gloves properly by turning them inside out, disposing them in a proper place like a hazardous material wastebasket, and then deeply cleaning our hands afterwards then too. So very generally speaking, we take care of all type of cleanup that we need to do. Signs of infection, okay? Last thing, and we'll call it a day. Even small minor wounds have the potential for infection, and they can all be life-threatening. So it's the best defense is to keep it clean, but these are our signals to know about if we see an infection taking place. Number one, the area could be swollen or red. It could feel warm. It could be like a throbbing sensation or a painful sensation at that site. There could be pus discharge. The person is often going to then have a fever. So if we're looking at 100 degrees or higher, fever, and they have a severe injury where you can see like it's red or swollen or tender, there's probably an infection taking place. Good idea to go talk to the doctor. A severe infection, you're going to actually see streaks coming from that region where the injury site was. This is the worst case scenario. You've delayed care for far too long already. Get this person to the hospital immediately. So just keep it clean, right? Apply antibiotic ointments. Keep it covered. Keep it from being too moist overall. So change those coverings daily. Care is very key here. If we can care for things and prevent, right, further things from happening, we're going to be a lot better in the long run. Next time, we're going to cover soft tissue injuries part 2, focusing on those musculoskeletal aspects like broken bones, ligaments, and tendons. See you next week. Hi, class. Welcome back to the American Red Cross First Aid Certification course. My name is Kyle Fogel, your instructor, and this week we are covering soft tissue injuries, internal and external bleeding as well. So we're primarily looking at Chapter 7 from your participation manual. So do chime in there. Page 98 is the page to go with there, okay? If you do have that participation manual right here, 98. There's your page you need to start at. There's plenty of pictures in there, and I'll refer to some of them every once in a while. The great thing is that it gives you that actual visual standpoint of what I talk about here on camera. I know I can't show you these injuries, right? So the pictures are going to give you the best option to see this in the visual component. So do read through your book, observe all those things, and it'll give you a better idea of what I'm speaking about when you do watch these videos. Now let's go ahead and talk about the different types of bleeding that there are. Mainly though, bleeding, right, is an escape of blood from blood vessels. And the blood vessels that we're looking at are things like veins, arteries. This will also get to the smaller blood vessels like capillaries too, which is the network of where oxygen is being exchanged into tissues. So you could say it's the connecting point of veins and arteries. Now, the two types of bleeding, right? We have external versus internal. Pretty simple, right? External bleeding, we can see blood, we see red outside the skin. Versus internal bleeding, that's something we're going to see superficial, below the skin, into the deeper layers such as the musculature, bone bruises. We can also look at the body cavities and we can see how blood can, per se, pool in those cavities. Then we can see separation. So we had gone over the very first chapter and covered body cavities. This is where we're going to see more and more where internal bleeding can arise from. Is it the thoracic cavity? Is it the abdominal cavity? Is it the pelvic cavity? Now a hemorrhage is when we're seeing large amount of bleeding in a very short period of time, and we can observe this. With external bleeding, pretty fast, we can see blood spewing, I guess you could say, out of a blood vessel. At this point, of course, we want to put direct pressure on the wound and then find a closest pressure point to slow down that bleeding, if not stop that bleeding altogether from that blood vessel if we can help it. Hemorrhages are always going to be I guess you'd say, severe injury. So we want to make sure we have somebody or someone calling 911 immediately, and we are dealing with this injury as soon as physically possible. Same thing with internal hemorrhaging. You could rupture an organ, and in this case, we'll see a large amount of bleeding within a body cavity very quickly. Blood, let's define what it is. It is the one liquid tissue in the human body. So when you think about histology, what it looks like at the microscopic level, right? Blood is primarily a liquid composed substance, so it's pretty neat. We're looking at about 55% being liquid, and we have about a 45% component of being solids. And those solids are going to consist of things like red and white blood cells. So red blood cells are going to be the ones exchanging oxygen to tissues, taking away carbon dioxide from the body. And white blood cells are going to be our basic immune response to foreign invaders. We're also going to find platelets, which are fragments of blood cells that can be used to help with wound healing. And that's going to be becoming very important for us, of course, when we are putting any pressure on any wounds, that platelets can actually go to that location and start healing that wound. So roughly, if we want to go ahead and talk about it a little bit more, blood, how much blood does the human body have? Well, you could give or take, say, 7-8 pints, okay? When we're talking about that, that's a lot of blood, okay? So if we want to imagine how much blood we lose, if you ever go give blood at the American Red Cross, right, or their facility, all right, they usually take 1 pint of blood from you, okay? That's a safe amount of blood to lose. So put that in perspective. If somebody were to lose that amount of blood and then some more, it's a very dangerous situation. They could be severely compromised to where they could go into sudden shock. So we could have a shutdown of organ systems if too much blood is lost. So that's why it's so pivotal, so important that we can put direct pressure on a wound. Of course, glove hand, clean gauze, so on and so forth. But we want to make sure that we're keeping blood where it's supposed to be, right? Hopefully within blood vessels. If we identify blood outside of those pathways, of course we put proper pressure on wounds for external wounds, and then we go ahead and call 911 when we see those internal bleeding hemorrhages. Just to show you a little bit more about that network of blood vessels I was talking to you about, right? Veins, we could say I can draw in blue here. And these little ones that come off the veins, the main veins here, let's thicken up that vein, for instance, right? Veins are going to be carrying deoxygenated blood, so blood that's returning to the heart. That's going to be pumped to the pulmonary system, oxygenated, sent back to the heart, and then pumped to the rest of the body. Versus the opposite side, we can just go ahead and make a drawing. We have arteries. There's my really thick artery, and arteries are going to connect down to this network. So we have arteries in red. Arteries are red because we're saying that they are oxygenated. They have received blood from the pulmonary circuit, pumped to the heart, and pumped to the rest of the body. So this is going to, for instance, let's say out to our arm. Arteries away. That means blood has to be pumped very forcefully through these vessels. So by pushing blood forcefully, they have to have a stronger outer coating, I guess you could say, the tunica media specifically, what it's called, the thickness, the muscularity, strengthness, I guess you could say, to a blood vessel. Anyway, this is going to have blood forcefully pumping through it, all the way to the exchange area, which would be called like the capillaries. Would be like the bed within a muscle. Muscle needs oxygen to produce energy, or produce movement, I guess you could say. So in the middle here, where the arteries lead to, they're going to lead to the capillaries, that exchange area. Once the oxygen is removed from the blood is then going to continue forward, and it's going to be going back towards the heart through veins. So we have oxygenated versus deoxygenated blood. We also have to look at the color then, so we can see this as an external component. We can see that blood, usually, from an artery, is going to be very, very, very bright red, because it's full of oxygen. It's also going to be more or less spewing, or we could say pulse or squirting out of this type of blood vessel. Not trying to be too gory or gross for you, but if you ever want to see an example of this, Sweeney Todd, right? Every kind of injury in that one, you see a lot of blood squirting out, okay? Squirting blood means it's coming from an artery. These are the worst types of injuries possible. Any kind of external bleeding, arterial bleeding, large amount of blood leaving that vessel at a very high rate. We need direct pressure. We need to call 911 sometimes as well, especially if we see a large amount. When we're looking at arterial bleeding, that's much worse than what we would see with a capillary bleeding. Capillary bleeding tends to be more from the superficial aspect of the body. This can be more intermediate colored blood because it is being exchanged. But you're also going to be seeing that it's going to be leaving at a very slow rate because these are very extremely small networks. We can look at like a kid skins his knee. You look at your knee, right? It's not bleeding initially, but then you start to see that bleeding come through from the scrape. That is a good example of what capillary bleeding looks like. Dangerous? Probably not. Infection could set in? Yeah, absolutely. But are we looking at immediate danger for sudden illness? Are they going to lose a lot of blood? No. So capillary bleeding, not a significant injury. Again, arterial bleeding, definitely. Venous bleeding sometimes can become very dangerous and depends on how the vessel has been opened or cut. For a basic, more superficial vein cut, we're going to be seeing very dark blood. Blood is almost going to look like a deep red, not really sure how to, you could say a dark crimson color. It's also going to be leaving the wound very slowly, so it more or less just seeps out of that, okay? Controlled? Yeah, it can be controlled. Easily, much easier than arterial bleeding. So dangerous sometimes, but rarely overall. The ones that we definitely want to call 911 for or take the person to the hospital are going to be those arterial bleeding aspects. Okay. Skipping ahead. The basics that we're going to use for any type of direct bleeding when it's involving external bleeding, right, is direct pressure. So external bleeding, we see a wound, right? Somebody has a big scrape on their arm, and we say, hey, I'm certified in first aid, may I help you with that wound? I just so happen to have my first aid kit in my vehicle. Bring it out. First thing to do is, you already told them that you're trained and they've asked for your help, absolutely good. You put your gloves on your hands, right? That's our first line of defense as a personal protective equipment standpoint. We want to make sure we aren't getting contaminated nor contaminating that person with anything as well. From there, we grab some gauze and we put direct pressure on that wound. When we say direct pressure, we're putting the pad or the gauze directly over the wound itself. So we're trying to, in a sense, stop the bleeding altogether. This is the most effective way of controlling external bleeding first and foremost. So we take that sterile bandage, gloved hand, place it on the wound. Maintain that pressure, and we're going to maintain it by applying maybe a pressure bandage like an elastic wrap, or just keeping our gloved hand on there and holding it on for up to 10 minutes sometimes. Our goal is to get the blood to, I guess you'd say, harden, okay? Give the chance to dry out and clot up, and not really clot up, I should say, but stop bleeding, okay? What's happening at the deep microscopic level is that the blood has this stuff that, as it dries, right, causes this stringy substance to form, fibrin. And the stringy substance almost creates like a network of webs at the wound, so that way, as platelets arrive, they are trapped, and it stops the bleeding altogether. So it's a really cool idea of what the body can do. It takes time for that to happen, sometimes up to 10 minutes. So that's why even with like a bloody nose, right? And you're like, oh, okay, I think stop bleeding. Wait a good 10 minutes. That's going to ensure that the fibrin has made that network so the bleeding can stop altogether. Any type of severe external bleeding that even with a gloved hand, right, in the first place, and gauze is not slowing down, we want to go ahead and reapply more gauze immediately. We don't take those gauze off, right? We have the coagulation process going. I can't even speak today. Sorry. Coagulation process going on. So we're going to have that gauze on there, and we're simply just going to add more gauze on top of that gauze. If we look at the gauze then and do it a third time, and we've had to put more gauze on there to see if we can control the bleeding, by then we should know extreme, this is bad, right? If we see through 3 layers of extra gauze, or 2 layers even for that matter, the blood is not slowing down, it's going to be a good idea to call 911 and tell them about the situation at hand. They're probably going to send an EMT unit so they can deal with this extreme external bleeding. So it's kind of more, I guess you could say, is intuition based. I mean, you'll know when you see something like this. I can't really explain it to you perfectly, but you're going to see a situation possibly where it's extreme bleeding or extreme external bleeding. First and foremost, call 911, put direct pressure on that wound. Get somebody on the way. We're looking at car accidents. We're looking at really bad motorcycle accidents. We're looking at severe burns, all these different things where there could be extreme external bleeding and amputation. We want to just go ahead and call 911 first and foremost. When in doubt, right, call 911. Other things then too that we can do is monitor the person's condition, right? You're going to be able to see sometimes when somebody's losing a lot of blood, they could start to want to maybe pass out or come in and out of the consciousness state. So try to talk to them. Try to keep them aware of you being there. Keep them focused if you can, so to speak. Reassure them that everything's going to be okay, and keep them in a very controlled environment if so. So from getting overheated, over chilled, just keep them as comfortable as possible, and then wait until EMTs arrive, or if you can take care of the wound and they seem fine and everything like that, it's more of a minor wound, go ahead and wash your hands right after you've dealt with that. Take the gloves off, wash your hands, make sure you are being super clean about everything. Advise the person that it's probably going to be important then to change their wrappings probably within a 4 to 6 hour time frame, so that way they can clean the wound a little bit more, and fresh gauze. Just little simple things to prevent infections. For severe bleeding, for using tourniquets, I can't teach you that right now. I'm going to have to show you that in person. But there's a cool technique where all you need is that triangular bandage and something like a strong rod, like a pen could work, or even like a marker, something like that. A stick could work as well. But we can create a tourniquet, kind of like how a blood pressure cuff stops the blood flow to see what type of pressure is needed at minimum amounts when the heart's beating or at rest to produce blood flow through a vessel. That's in a sense what we're trying to do, but we're trying to stop blood flow altogether down that artery particularly, because that's when we have severe external bleeding going on. Severe bleeding is usually arterial bleeding, and that means we're going to have to stop blood at a more proximal aspect. So if I'm bleeding heavily from, say for instance, I have a brachial artery here that's been severed, and direct pressure is not working, we have to go up towards my armpit, and we're going to have to put a tourniquet closer by my shoulder, tighten that so it stops the blood from flowing towards that wound. We apply direct pressure and hold that pressure at the same time to stop the bleeding. That's the one and only way, and we wait for 911 to arrive till they take over, and then good, awesome, we're helping to save a life. So that's always a last effort, a tourniquet, if EMTs are delayed, if the direct pressure does not stop bleeding alone. Okay. Internal bleeding. Okay. Again, you can go in your book, you can see some good pictures of what it looks like for internal bleeding. Internal bleeding is the escape of blood from arteries, capillaries, or veins that are within body spaces. So we're looking at maybe a bone bruise, we're looking at a basic bruise on a muscle, right? You get hit with a baseball or at the ankle with a baseball. We can see bone bruises versus bruises of the muscles. We can also have then rupturing of different types of vessels, or we can have different types of organs rupturing, or we can see the bleeding within body cavities. So like I had mentioned, thoracic cavity versus abdominal cavity. The diaphragm, you could say, is a separation point. So if we see bleeding above, we have bleeding within the thoracic cavity. That houses the lungs, it houses the heart, it also houses some other major blood vessels that flow through, like the superior and inferior vena cava, as well as the abdominal aorta, or so I should say the thoracic aorta. Abdominal aorta would be lower, where we would see a very large network of different organs, which could all be losing blood. So you see pooling of blood in that region. Now, shock will take place when the body's ability to adapt to this physical stress of an injury or illness fails, right? We've lost enough blood to where the organ itself is not getting enough blood or oxygenated blood. Now we're going to have total system failure. It is pivotal that we've called 911 before or after this point, and hopefully if we've identified it by then. Other causes of severe internal bleeding. So let's just think of some scenarios. We could think of like a very extreme blunt force trauma, like being thrown against a steering wheel in a car crash. We could see that, right? We go to the car, we see immediately that the person was not wearing the seatbelt. A blunt force trauma to the chest could cause severe internal bleeding. In that case, we'd want to probably lift up the person's shirt to see if we can see any wound, right? Or if that's internally bleeding wound, or from the abdominal region even too. Sometimes people wear their seatbelts wrong. It's called a lap belt for a reason. You put it over your lap so that way it goes over your hip bone. If you put it over your stomach, now it's a stomach strap, I guess you could say. Well, imagine the force of the seatbelt catching you from going forward at 40 miles per hour, right? Now you're going to have blunt force trauma or a severing wound even to the abdominal cavity. This can cause a lot of injuries then as well. So see how people wear their equipment, right? If they wear their seatbelt underneath their arm, you could see a very severe injury occur from just something as that. Because nylon, that material that your seatbelt is made out of, is extremely strong and it's very sharp at certain points. And if it's worn incorrectly, it can actually sometimes cause more injuries than prevent injuries. So safety first, wear your seatbelt correctly. Other kind of conditions we could look at, though, are chronic medical conditions like ulcers. Stomach ulcers would mean that somebody could have a rupture, and there could be a lot of blood in the abdominal cavity. Objects that penetrate the skin and damages internal structures, like a knife wound or a bullet wound, those can cause internal organs to hemorrhage as well. So many types of injuries, we're seeing these all as severe. We call 911 first and foremost. Like I said, there's a great picture in your book. It's going to show a gentleman's stomach, and you're going to see a little bit of that rupturing. So it's going to look like the region of where his liver and stomach would be. You can see that internal bleeding aspect going on from either a blunt force trauma or some other kind of wound. So it's going to look swollen, it's going to look tender, it's going to be hard perhaps or bruised looking in the abdominal region. The person could look pale, they could look cool or moist, even a bluish tint to their skin. They could be vomiting up blood, coughing up blood. If you ever hear of excessive thirst, that means they're getting towards shock. That's a very bad situation. We should have called 911 by now. If they have a altered mental state, these are all severe, obvious signs of internal bleeding. Call 911 as soon as you recognize any kinds of these signals, and then shock is coming. I'll tell you that. For minor internal bleeding, right, somebody gets hit with a baseball in the arm, right, you get a bruise right there. You give it a couple days to a couple weeks, the bruise is gone. No big deal, right? It's sore, right? Those are simple things, simple contusions. These aren't necessarily things to write home about. They're not reasons to go to the doctor. They're not reasons to go necessarily to the hospital right away. But they are reasons to want to go ahead and maintain some kind of proper care in the first place. So simple enough, right? You get a bruise to a kid playing baseball on their arm. You put an ice pack on it. You have them sit on the bench for the rest of the game or part of the game. Usually an ice pack alone is going to be really good enough because that's going to help diminish the amount of pain. We want to always make sure there's a barrier with any kind of ice pack because that can cause further damage to tissues. So a t-shirt's good, you're right, you put that over the top of the t-shirt, but if you wrap it with some kind of coverings, you could say like a towel, that's a perfect scenario for an ice pack, and then put it on the person's skin. That way you're not having direct contact with that ice pack. Ice is generally speaking okay to put on somebody's skin because it's going to melt. An ice pack gets much colder than 32 degrees. It actually gets down to the zeros to negatives, so that can actually cause a frostbite to the skin. We will not want to put direct contact with that onto somebody's skin. If we ever do suspect, though, that with severe internal bleedings, as I mentioned before, we just call 911. Keep them comfortable as possible in the meantime until EMTs arrive. Let me give you a couple scenarios and we'll call it a day for the video. Next time we'll jump into our 6 different types of soft tissue injuries. Here's your scenario. At work, you are called to assist a coworker who has been injured in a 5-foot fall from a ladder. As you arrive, you notice the person sitting on the ground, writhing in pain and having trouble breathing as he clutches his arm to his chest. You want to help, so how do you respond? Okay, so think about that scenario. How would you respond in that situation? What I want you to do is go ahead and in the comments below, give a general synopsis of how you believe would be the best case way to deal with that injury. If you're not on YouTube already, you don't have a channel or whatever it is, a page or signed in, go ahead and send me an email, short 1 paragraph telling me how you would deal with that scenario. I got one more for you. Okay, you witness a bicyclist suddenly veer off a bike path, lose control of her bike and crash in a rough gravel patch on the side of the road. A bystander witnessed the accident and tells you that the bicyclist broke her fall with her body and did not strike her head. The bicyclist was wearing a helmet and still is. As you approach, you see the bicyclist struggling to sit up, holding her thigh and moaning. Blood is spurting onto the pavement from a large deep gash on the person's thigh, and you want to help, so how do you proceed? Well, I'll answer this one for you. First off, you tell the person, hello, my name is Kyle. I am certified in first aid, may I help you? They're probably going to shake their head, crying in pain. Yeah, please. You show up and have your first aid kit, so you bring that with you. You put on your gloves. You ask the person maybe what happened, because again, the bystander said they didn't hit their head. Maybe bring that bystander with you, because he might have to call 911 if you think you cannot control this bleeding by yourself. All right? The first thing you'd want to do is, with your gloved hands, take the gauze from your kit and put direct pressure on this wound, because again, what we're seeing is blood spurting out. We might even want to take our triangular bandage, fold that up in the position to where we can use that as an overlayer of the gauze then too, to control that bleeding even more. But if we have 2 triangular bandages, this would be the time to start getting one prepped up, because we might have to manufacture a tourniquet, but we're going to call 911 first, okay? As I said, I haven't taught you guys how to do a tourniquet, so I'm not going to certify you that right now. I don't recommend anybody right now to try making a tourniquet on their own without proper education on that. So we'll talk about that later. But our best case scenario will be to put on our gloves, start applying pressure immediately, have that bystander call 911 right now, because we know that we may not be able to control this severe external bleeding. Okay, best case scenario right there. 911 is called. So go ahead and leave that message or that comment about the last scenario beforehand, what I talked about here with the fall from the 5-foot ladder. He's clutching his arm to his chest. What would you do? See you next time.